This is WECT News.
Good evening and thanks so much for joining us tonight. I'm Daniela Hankey. A program that is saving the state thousands for each person on Medicaid locally could soon expand to cover all 100 counties in North Carolina. It's called the Healthy Opportunities Pilot Program. WECT's Delaney Tarpley talked to the program lead in our area, where this program has been up and running for about 2 years. Delaney, why does she say it's so important that this program gets implemented statewide?
Daniela, she tells me that this program is not only saving the state a lot of money, but it's also helping close to 10,000 people in our area on Medicaid achieve healthier lifestyles. She says she only sees the benefits to implementing this program statewide, but it'll need the backing of some state leaders to get there.
These boxes
Carrots next.
are carrying more than just healthy food.
These boxes that you see will go out on Monday.
We have found the most effective way to lower healthcare costs is to reduce the demand.
The Healthy Opportunities Pilot Program has been up and running in the Cape Fear region for about 2 years.
So I really think we're seeing some really strong outcomes already.
The program helps people on Medicaid with non-medical needs, things like healthy food access, transportation, housing, and domestic violence help.
So we've actually helped over 10,000 individuals.
They say social interventions like these prevent people from needing medical treatment.
We have been focused here at North Carolina Medicaid on not just buying health care, but on buying health. What we've seen is a reduction in ER visits. We've seen a reduction in inpatient day stays, and these have really positive consequences.
The director for community care of the Lower Cape Fear, our local Healthy Opportunities Pilot Program, says the state has already saved thousands.
A savings of $85 per member per month in terms of health care costs.
That's more than $1,000 per person per year. And they say these savings could grow. Right now, the program is in 33 counties. But during the final weeks of the Biden administration, the Center for Medicaid Services approved an extension that gives the state the option of taking the program statewide.
The approval that we received from CMS, it acknowledges the impact of healthy opportunities. The governor will be submitting a budget coming up, we hope that the governor is able to find the necessary funding to at least seed this program.
Do you want to do like oranges or something?
With the goal to help thousands more North Carolinians stay safe, happy, and of course, healthy.
This pilot program is one of the first large-scale tests in the country of whether providing non-medical services can boost health outcomes and cut healthcare costs. If it continues going well, it could serve as a model for other states in the future. Delaney Tarpley, WECT News.